Bobsy.
Welcome, everybody. Welcome. Thank you guys so much for tuning into this particular episode of the My Brother show. I am your host, Maurice Rush, and I am really excited to be here. You know, God is good. I am very blessed and this is a long day today, but you know we're here. We're pushing through. I still have hair, guys. So if you've been watching from season one, you see I done went from bald to having hair again. I'm very proud about my hair too. It's getting longer too, guys. So one day when I come on here with cornrows, don't say nothing to me, because you know we back. But all right, so as you know, this episode, if you've been following the promotions, we're following up the conversation from Gluttony. You know, 2 weeks ago. Um, we had our two fitness professionals, my brother Frank Robinson and my brother Ishmael. And they came in and they talked about, you know, exercise. They talked about the importance of diet and nutrition, how to read the nutrition labels, serotonin, which was a word I didn't know before 2 weeks ago, but I do know what serotonin is now. And they did a really good job of kind of tackling this idea of gluttony from the fitness aspect. So I said, well, how do we do this again? And I said, you know what? Let's tackle it from the medical standpoint. And I asked, you know, two of my great, well, one's actually my family, but I was going to say, but two people that I love to join this episode and talk about what what impacts of gluttony from a medical standpoint. So I have my cousin Natasha and my good homie Barry coming on. But before I introduce them, I do have one quick, well, you know, my typical. I'm sorry, I didn't have the comments clicked up, but my boy Vince, Vince will actually be on in a couple of weeks on an episode. But my boy Vince, I'm also come on here. I appreciate that, bro. My mom is here. Hey, mom, I love you. I gotta greet my mama first. You know, my mom, she's been my number one supporter. She texts me every single week at 7:01 if I'm not live. So I appreciate you that for that, mom. But so my two quick housekeeping things, as you see it scrolling at the bottom, please go and follow us on Instagram at the My Brother Show. We post snippets of the episode. I try to post like just some inspirational things for men in general. Um, and just like fun stuff, you know, like I'm a fun guy. You can follow my personal page. You can see it's right there at Rushzilla. That's my personal page. If you want to see some pictures of me with my children, um, and the occasional meme, that's where you follow my personal page at. And then any donations that you would like to send to support what I'm doing here, it could go to merchandise. It goes to just like I told you guys, I'm going through a move right now, so excuse my background. I haven't quite unpacked yet. I'm getting there. But it goes to like merchandise, it goes to, you know, guests, it goes to a bunch of different things that donations go to. Like right now, I need a new headset, if you can't tell by this one in my ear. So any donations can be sent to $ my brother. Okay, now that that's out the way, this is my favorite part. Y'all don't understand how much of this part I enjoy. I get to introduce my guests. I really love the opportunity to introduce people because I don't ask for bios, and I don't. So like I'm always waiting the intros. I should probably start asking for bios sometime. But you know, it's funner to let people know how you feel. And I firmly believe in giving people their roses while they're here. So when I introduce my guests, I get an opportunity to give them their roses while they're here. So um, excuse me. My first guest, he is all the way from sunny Florida. All the way from, look at that, I'm worldwide because 2 weeks ago I had Frank all the way from California, and now I'm all the way from sunny Florida. He is awesome with I was going to say an awesome father, but awesome with an AU. He is a father of a child with autism. We actually met through the Autism in Black panel that I was on a few months ago with his wife. I met him through his wife. He is an amazing brother. I actually put MD on the flyer when I put his name on there. He corrected it to DO, so that's my bad. Look, my degree is in marketing, and I messed that up. I did fix it in like the in the actual explanation, but like my bad about that. But I am really excited to introduce Dr. Berry Pierre. He's an amazing brother. Barry, what's going on, bro?
First of all, shout out to Mom for the accountability. What's so funny, especially in our world, a lot of times we need that one person, right, who we know is going to be dependable, and not only dependable on making sure we're doing what we're supposed to do. So shout out to Mom, much appreciated for sure. And again, no, I'm excited. I'm excited to just join and be able to be a part of this community. Like I said, we had a chance meeting my wife's panel during her conference, and I was like, I love this brother's energy right here.
Yeah.
Right? And obviously this was like via Zoom, but you can just kind of feel the energy, feel the love. And I said, all right, this is the person I need to keep close. So when you reached out, I said, oh, of course. And
right.
Let me put it out now. That way he can't say no. I need him on my podcast. Mom, let's hold him accountable and say, hey, Dr. Berry said you're supposed to be on this podcast. Like, so let's put that out there now. No, appreciate it. I can't wait to have our discussion tonight.
Yeah, it was crazy because when I sent you the message on Instagram, I didn't check how many followers you had. And then I sent it and I was like, oh man, he got 10,000 followers. He not about to see this, Sean. So I started going through my head like, all right, who else can I have on? Who else can I have on? And then boom, you responded. I said, oh, look at that.
I said, I don't even need to know the topic. You want me where?
Right.
Okay. What we get there.
So this is great, man. And then next, this is my cousin, man. I was telling him right before we went live, I was talking about a story about how she used to wipe my butt when I was a kid. And I asked her, and she was like, I don't do public speaking, which I get a lot from people when I ask them to come on these formats. I don't do public speaking. Then she said, you know what? I'm only going to do it because it's you. So I'm really I love having my family members on just because I think that it's important, just like full circle from what I'm trying to do with this show. It's important to see like a Black family supporting one another, right? So like I really love the opportunity to get my family members on here. So I'm really proud of the woman that she is. She's an RN. She's been an RN probably for as long as I knew what the word meant. She told me earlier today that she started being an RN in 2003. I don't even think I was in high school yet in 2003. I might be aging myself there, Barry. Don't feel bad. She's always available to talk, man. Like she's that family member that my mom calls and is like, "Hey, your cousin's coming over today." And I'm like, all right, well, I got to cancel my plans to go to my mom's house to go spend time with my cousin. And I'm so honored to have my cousin, Natasha Thomas. Tosh.
Oh, hi, cousin. That was such a nice introduction.
I'm telling you, man, you gotta give people your roses while they're here, man. Life is really short, and I don't anticipate passing away for another 50 years or so. But on the off chance that something crazy happens, I want you to know that I love you.
Oh,
I love that.
All right, enough of the mushy stuff. You gonna make me.
She's also all the way from Pottstown. She's all the way in Pottstown. Well, not all the way. It's not quite Florida, but it's still like an hour away. So,
Well, I'm glad to be here. I'm only here because of you. So
it's your aunt.
oh.
Tasha. All right. So before we jump into the conversation, I just want to give you guys the opportunity to introduce your work in the field, what you do, how long you've been doing it, and things along that nature.
Okay. Did you want to go first, Dr. Pierre?
Oh, sure. Dr. Pierre, I'm a board certified internist, which pretty much means I just kind of specialize in all the internal organs in our body system. I primarily work in the hospital setting at this point, kind of taking care of our acute related care patients and, from strokes and heart attacks, obviously COVID and a whole bunch of other things there. I'm a father of 3, husband of, Maria, Davis Pierre.
I thought you was about to say a husband of 3. I was about to say, whoa! I was like, whoa.
And I tell people all the time, my wife's really, I'm just here for now. And, my wife's really the superstar in the family. I'm just the lowly physician. I'm just here. And I'm excited. I love talking, love educating. That's kind of been my platform pretty much from the beginning. Podcasting, vlogging, everything's about health education and, just, getting us better, empowering ourselves for better health.
All right, Tosh.
So I've been a nurse for about 18 years now. I started nursing in 2003. You were right. I've worked in multiple fields. I started in the surgical ICU at Einstein. So saw a lot of traumas, gunshot wounds, car accidents, did a lot of transplant work, kidney transplants, liver transplants, that sort of thing. Ended up moving from surgical ICU trauma. It just got too much with kids. But I worked in the trauma field for almost 7 to 8 years. Then I went to home care. So I've done home care. I've worked in the pharmaceutical industry, mainly focusing on like ADHD medications, GI medications. And right now I'm working at a company that primarily focuses on insurance related issues surrounding healthcare. We do nurse line, we focus on wellness, maintaining health, just giving health information. It's strange when I get a lot of these calls and you realize how much people really don't know. So it's been interesting. A lot of teaching, a lot of education.
Oh, yes.
Look at that. That's Mill. Mill just gave you a hey cousin, too.
Hey,
Shout out to Jamil. Congratulations, my brother. How old is my niece now? She was born on the 14th. My niece is 13 days old today. I think last episode I said publicly, I think that she's in the hospital pushing my niece out now. She wasn't until the next day, but congratulations to you, Mill. I'm so excited to, see you grow into this fatherhood. This is his first, Barry. So, yeah, that's my brother's first kid.
Shout out to fatherhood.
Yeah. So, all right. So let's jump into the discussion. So I always try to start off with a layup just to kind of get the blood rolling because I know sometimes people are nervous. So my first question is just what health issues have you guys seen that are directly related to diet issues as we talk about gluttony, right?
A lot. As a nurse, I'll just touch on the main things. Type 2 diabetes is a big issue. I don't think people realize the cost that goes into caring for someone with type 2 diabetes and then the costs that arise when they don't properly manage their condition. Coronary artery disease is a big one. A lot of heart issues, plaque buildup can lead to a lot of things, stroke, a lot of heart attacks, high blood pressure, sleep apnea is a main one now. And we're having a lot of issues with sleep apnea. When you gain weight, it really affects the way you sleep, and sleep is very important to maintaining a healthy lifestyle. It affects a lot of things from the chemicals, your body produced to just your immunity and feeling rested, your mental health. It messes up a lot of things, and a lot of people, have issues with sleep apnea as they gain weight and are unable to lose it. Those are just the main things that I can think of right now. Stroke is a big issue, but that goes back to heart disease, coronary artery disease, plaque buildup, high cholesterol, again, goes to heart disease. There's just so many issues that come up when people don't watch their weight. It's crazy.
And, especially, what Natasha kind of touches on is the fact that a lot of the things, especially we see in our field, is the end stage products of a poor beginning, right? A poor, and usually we talk about, especially when we talk about eating, it's usually like that beginning, like it's just a burger, it's just a fry, it's just something. And then we typically see the end results, right? We see patients with a stroke, the patients on dialysis, the patient with a heart attack, the patients who end up getting amputations of their, like we see all of these end stage, and we know that if we could have saw you 5-10 years and maybe told you, take this medication here, work out a little bit there, eat less of this, like we wouldn't see you there, unfortunately. And I think that's really the problem, is that there's usually no immediate effects of the poor foundation of diet.
Which is crazy, Taj, because if you remember, what was it, like August, I got my blood pressure very, and I'm typically like a 110/64. I talked about this last episode. I was like a 129/94. And I texted her, I said, cousin, am I about to die? And she said, no, but now's the time to start watching it, because if not, I'm 33 now. She's like, you're going to be 38 taking 1 million pills and stuff. And like, check it down. And that to me was like, man, like I remember, and just to be transparent, I haven't been to the doctor in a while, but my commitment is to make an appointment before the end of this year. But I remember, like, when I first got health insurance out of college, Barry, and I went schedule my first appointment, I'm like 23 or 24. And I walk into this doctor's office. I'm like a healthy, active 23, 24. And the doctor was like, well, what you here for? And I was like, I mean, you're supposed to do an annual? He was like, you got any pain? I'm like, no. He was like, anything wrong? I'm like, no. Like, but aren't you supposed to do an annual? Like, he was like, oh, I mean, like, you cool. So he did like the regular stuff. And then he was like, all right, you come see me in like 2 or 3 years. And like, I just feel like that was terrible. Like, I really feel like that was terrible.
You saw our look. That was
like terrible advice. But that what was that about though? Like, have y'all seen that before?
I see it.
Typically, yeah, we see it, especially when you're young, that we downplay any health related effects because you're young, because you're healthy, because you're fit. And I think especially now when we start to look back, we're like, wow, maybe if we would have like been a little bit more aggressive, like in the beginning, like making sure, like, Maurice got his yearly checkup, where we just make sure his blood pressure is straight, his diabetes in check, his kidneys. Like, if we just did those little things here, we wouldn't be having to deal with some of the end stage when he gets to like 30, 33, 35.
Tosh?
Yeah, I've seen that a lot. I talk to people every day. They call with all kind of things. A lot of people call and complain about their doctors, just for that main reason. Yes, you're healthy and you didn't have any problems, but for him to tell you to come back in 2 to 3 years, that's ridiculous, because anything can happen within that time frame. You get a free physical every year if you have insurance. Why not utilize it? Those 2 to 3 years that you waited, who knows what could have happened and what could have been prevented if you would have just went for your yearly, physical. But it all goes into like the problem with health insurance that I won't even start getting into, because it's just too many problems. But, you have these doctors, everything is kind of shifting toward the for-profit, model. And the idea is that they get people in and they get them out quickly. So they see a young guy like you and they're like, oh, there's nothing wrong with him. I literally went to a doctor and they went like this on my body and said, oh, and freaked me out. So as a nurse, I'm like, what?
I hope they don't do this in Florida, Barry. Hey, Barry, that's how you see in your appointment.
Sometimes I see some of my colleagues do some things. My medical students, my residents, I'm like nah, like, please put your stethoscope on the patient. Like,
it blew my mind.
Like, let's fake it.
Exactly, like fake like you care. But I think they see someone young and you don't look like you have any major issues, and they just, they want you in and out as fast as they can so they can move on to the next patient, or maybe give that older person a little more time, and it's crazy. Like, I was in shock, and I purposely don't tell doctors that I'm a nurse, just because I think people get a little weird, and you're doing things that you wouldn't necessarily do, which I don't want, because sometimes that can lead to a problem. But the fact that this doctor literally just rubbed your hands on my arms and legs and said goodbye is a big problem. So to hear that your doctor told you come back in 2 to 3 years, it is a problem. They should advocate that you come in every year for your physical so that they can look at your blood work, and start working on issues that may arise, at as soon as it comes up, not wait 3 years later after you may have developed something to try to fix it, where they could have got a jump start on it, and maybe you wouldn't have needed medication. Maybe they would have told you, okay, maybe go and walk 3 days a week, or walk 5 days a week, maybe eat some more vegetables, and that could have fixed everything. Now, come 3 years later and it's a big problem. Now you have to take medication, which in and of itself can cause other issues. But that's a problem.
And it's crazy because,
especially because it just, like we talk about, because medicine's business. So the aspect of having a free wellness exam is actually new. Like, so it's not. It would make sense that from the beginning of time they should have gave everybody a free annual visit, but it's actually fairly recently new that, like, hey, you can't charge people for the annual visit, like, or they're not what's going to happen, they're not going to be encouraged to come. But again, it doesn't make any sense, especially when you're in the field. You're like, oh, but if I could have just checked his blood pressure, make sure his kidneys are, like, I wouldn't have to deal with it. But like, it's, and again, the only reason why, again, I'm in the field, right? So I can say it. The only reason why they even do that is because they realized that they were spending so much more money at the end, right? Like with the dialysis, with the stroke treatment, they were spending so much money over here. They're like, man, you know what? Let's put some of this money back on the beginning side, because we know we're going to save more money on the back end, unfortunately.
What's the old saying? An ounce of prevention is worth a pound of cure. And that's kind of what they were looking at. And so, there was a big shift in healthcare towards a preventative model. So you have free physicals and these free exams and screening. So, you definitely want to utilize it if it's available to you.
Definitely. The crazy thing about that whole 2 to 3 years thing. So I think in that 2 to 3 year period, that's when I tore my ACL. So I had HMO insurance. So I had to get a referral for everything. So I go to get this referral, and they're like, "Oh, you ain't been here in 2 years." And I'm like, you know what I'm saying? Like, so I'm like super annoyed. Like, you got to be kidding me. Like, only reason I haven't been here in 2 to 3 years because y'all told me not to come back for 2 to 3 years. And now I need a referral to get everything checked out because that's the only way my insurance is going to pay for it. So like, it's just crazy to think about like how that worked out for me. And like, luckily the guy who was like controlling the referrals, he was like, yeah, you ain't been here. You honestly can't really get a referral if you haven't been here in X amount of time, but whatever, I'm going to do it for you anyway. So luckily I lucked up. But like, if you would have said, no, I'd have been ticked. I was already ticked off that it took me a month to get the surgery from the time that I tore the ligament in my knee. That would have been even longer. You know what I'm saying? So I'm literally walking around, like I was telling you guys, pretty sure I was walking around limping literally for the month. And Barry, like after the surgery, I didn't go straight to physical therapy. I don't know where I missed that instruction that I was supposed to go straight to physical therapy. So like I was like 2 weeks before I started physical therapy after the ACL reconstruction. And I get into physical therapy and they're like, yo, you can't straighten your leg out. And I'm like, yeah, I kind of been limping around for a month. And they were like, if we can't get your leg straightened within this week, you're going to have another operation. And I'm like, what? They were like, yeah, scar tissue is going to build up in there and we're going to have to go in there again. And I'm sitting here like, well, if I would have got the dang on surgery right away, then I wouldn't have been walking around limping on it for a year. And like, there's so many things. And like I said, I was blessed to be able to kind of like be okay, but I can only envision the people who weren't privileged enough as I was, or lucky enough as I was to do it. So, with that in mind, that's actually a pretty good transition to the next question, which is, why do you believe? I put black men here, but like my cousin so politely reminded me that it's not just black men, it's people. Like, why do you guys believe black men, people, or men in general, just stay away from the doctor? We kind of started talking about it a little bit, but like, what other reasons do you guys believe that is?
Well, since I'm not a man, I'll let Dr. Pierre. I have my thoughts, but I'll wait.
Yeah, no. So I kind of talked about this in the past, where when we talk about healthcare or just trying to get healthy, a lot of times we want to kind of model, right? So what typically happens, especially in medicine, right, is when you're young, you want to kind of emulate, especially in a healthy standpoint, like person you want to see, right? Like if you're gonna go see a doctor, you're gonna feel more comfortable seeing a doctor who kind of looks like you, who maybe do similar background, and you know, even if you don't know, right? Who think like you think, you know, like he may get what I'm saying just by the way I'm saying it. So you have a situation, especially for Black men, where the number of Black physicians are so small. Right. So that when you start thinking about like the likelihood that you will grow up, right, and see a Black physician as a primary care doctor, as an orthopedic surgeon, as a like the likelihood that you're going to see it is so small that you don't even feel connected to the healthcare system. So because you don't even feel connected to the healthcare system, like you have there's no umph in you, right, to want to go, right, see a doctor, right, and especially for men, right, like there's no you want to go, so you're like, nah, I'm cool. And I two reasons why men typically come see, especially when I was doing outpatient medicine, two reasons why men typically would come see me in an office is one, they had a family member or a spouse or they had somebody dragging them to the office and say, hey, like you ain't been seen in X amount of time, you are being seen today. I will wait in the waiting room. But if I hear that you didn't say all the stuff that I know you're going through, I'm going to come back and say, hey, did he forget to tell you this? Or the most important one is sexual dysfunction. So those are two biggest reasons why men in general, right? Men in general will typically come to the office, right, just to get checked out. So imagine if you're having sexual dysfunction and you have to tell a person who does not look like you, who does not come from your same background, like you're already going to be embarrassed in and of itself. Already gonna be embarrassed in itself. So like that's already such a huge barrier that kind of comes away. And then and you know, just Black men is small, Black physicians, female physicians small. Like healthcare providers, it's not a lot of us, unfortunately. So because we don't connect as much, it's much easier for us to be disconnected from that system.
Yeah, I feel like you made a really good point. At my job, one of the main services that we offer, we do assistance with locating providers. So we get people from all across the country that will call us to ask us to help them find anyone from a primary care provider to various specialists like urologists, gastro doctors. And I am finding a lot of African-American or people of color in general, they call specifically requesting doctors, you know, who are of color, and they say specifically, I want someone that looks like me, someone who knows what I'm dealing with. Those are their main concerns. And it's sad when you look at the searches and you see how few of us there is for them. I feel so bad. Yeah. Especially in these rural areas, like in the Midwest, you know, where it's predominantly white. Like I've had people of color call in tears. Like I need someone, you know, who thinks like me to see me. I don't trust, you know, anybody else. I want someone of color. And it's so hard to find doctors of color. So that I'm sure that's a big barrier. Like I've seen people put off so many necessary tests just because they can't find someone they feel is going to be, you know, able to understand what they're going through, especially for mental health. I know that's not what we're dealing with, but it's a big issue for mental health also.
And that's all. I mean, you hit it right on the head, and especially that aspect of trust. Because obviously I'm a physician, I'm an internist, right? I work in, you know, so you know, Maurice knows I've been doing a lot of education, right? Right. We can probably go. So when we have a history, right, of a system that has done us wrong, it is very difficult to then turn around and, you know, blame the people who were wronged and say, how come you're not coming back? Like, why you ain't come back over here? Well, we ain't come back because we know what y'all did, right? And because we know what y'all did, we're kind of, so it would be easier for us to come back if I was going to someone who looked like Dr. Pierre, but like ain't too many, right? So like I'm cool on the side of man. So yeah, the trusting is such a huge thing. Unfortunately, you know, that even me as a Black physician, male, I still have to work to gain. Trust of, you know, my patients, especially even people of color who look like, because they're like, yeah, doc, are you one of them, right? So I have to like kind of fight that as well sometimes too.
That is a crazy point, because I didn't even think about it from that aspect of like a trust. But like for me, like I said, I haven't been in a while, but my sister-in-law works in healthcare administration, and I text her. I said, "Hey, can you find me a black male doctor at your job, please?" And like then I had to say to myself, you know what? I'll just take a young male doctor. You know what I'm saying? Like I had to say it. I was like, I'll take a young male doctor. I just don't like. And then for my lack of trust, and I probably shouldn't say this publicly, but like I personally struggle with the elder generation of Caucasians because I feel like they grew up in a time where racism was socially acceptable. So for me to have a doctor in their 70s, I can't trust you with my health because I feel like you grew up in a time where it was okay to be racist. And personally, I don't feel like that went away. Like I feel like somewhere down there, deep inside of you, like you're still like, I shouldn't be seeing this N word, and I can't trust you with that. So I'm like, I can accept a young white male doctor, but like my preference would be a black male doctor, particularly a young black male doctor. And actually, my ACL surgeon was a black male, which was like amazing. The doctor who did my ACL surgery, but like literally, I didn't even have to look nothing up. When I pulled up his picture and saw he was black, I was like, "Yep, I'm going to him." I was
Well,
like,
that shouldn't be your only criteria, cousin. But I just
it wasn't, but I was like, I'm going to him. I looked him up after that, but like my mind was set. Like the moment I saw, he was like, I was like, oh, a black surgeon? Okay, cool. We good. Like, you know what I'm saying? But I get that lack of trust. My personal thought, and I'm coming from the social services side of things. I worked for the Department of Welfare here in Philadelphia for 5 years, so I kind of understand some of the hurdles that black men have had to go to get health insurance, right? And Tasha, we talked about it pretty show about how much health, like if you don't got no insurance, like even for a physical, you still about to like come out of your pocket money that you don't have. And the way the public assistance before Obamacare came into play, the way it was set up, was if you were a male without any kids, you didn't qualify for it. Like a low income male, you just didn't qualify with it for it. And women, since they're typically the primary parent of children, even if you have a co-child with a woman, she gets the benefits. The child can't be on two cases. So I would see men coming into the job before Obamacare kicked in, and they'd be like, "I need some insurance, man. I want to get my knee checked out, da da da." And I'm like, here's his disability form. You gotta take and get them to sign to say that you have a disability, and low literacy factors into things, right? So you can't read the form yourself if you're a low literacy level. I don't know what doctors are saying to me, and I like to think of myself as somewhat educated, but like there's times where I'm leaving the doctor's office and I'm like, I don't know what the hell he just told me to do. Like I don't know. Like you just said 17 words that you learned in med school that I never heard before. So luckily, I have a cousin who's an RN. My son's mom is an RN, so between the two of them, like they get all my like, what does this mean questions. But everyone's not that fortunate, right? And everyone's also not that. We talked about pride in September. Everyone's not that able to put their pride aside to say, I don't know what this means. Can you explain it to me? So, like when I thought about the answer to this question, I thought about, well, they don't have access, right, to the doctors because, like, you don't qualify for insurance and you aren't educated enough to advocate. Like me, I went there and they said come back in 2 to 3 years. I wasn't educated enough at that point in my life to say like, that doesn't sound right, doctor. Maybe I should come back next year and see you and not wait 2 to 3 years to come back and get a checkup. Like maybe, so that was kind of my thought about the whole thing. Tasha, looked like you wanted to say something.
Yeah, because like you said, we talked about this earlier, and that's why I mentioned it. It's not just black men, it's all men, because the biggest barrier to healthcare, I feel, is just cost, insurance, period. You have people, all kind of people, all across the country, who honestly can't even afford to go to the doctor. With the introduction over the last few years of these high deductible health plans, you can have people with health insurance that can't even access the services they need. I've seen people with high deductible health plans where they have a deductible of $8,000. And for people who aren't really familiar with what a high deductible health plan is, that's a health plan where you would have to pay $8,000 out of your pocket before your insurance would even kick in anything to help cover your costs outside of those preventative visits. So yes, your annual exam is going to be covered. Yes, your routine colonoscopy or mammogram may be covered. But, if you're sick and you need to be seen or you have some concerns about something outside of those preventative services, you're paying out of pocket the complete cost of that visit. So if your doctor office charges $300 to go in for an evaluation, you're paying that full $300. If the x-ray you need to evaluate this issue further is $300, you're paying that $300, and then there's so many other fees, interpretation fees, there's so many other fees, facility fees. People just can't afford it. So, yes, they want to be seen, but when they think about what they're going to have to pay out of pocket just to have this issue looked at, they're like, forget it, I'll just deal with it, So a lot of people just, they have these insurances, and it's not even that they don't want to go to the doctor. They just can't afford to go to the doctor.
That's such a telling time, especially when you kind of mention before Obamacare, Obamacare, and because and I always tell people, like, I don't know if y'all realize how bad insurance companies were before Obamacare. Like, I don't to the point where you couldn't even be accepted to be on insurance if you had crazy, like, oh, were you pregnant at one point? At one point, they were finding reasons not to give you insurance. And then, Maurice, you kind of talked about the literacy aspect of it, right? When we talk about these high deductibles, is because someone is selling them an insurance and says, like, oh, this one has the lowest monthly payment. And we just think like, oh, lowest monthly payment, that's cool, great, sign me up. Not realizing that the back end says, like, you got to pay $8,000 before, so it's one of those things where it's there's so many reasons. So that's why I never played the blame game on Black men or Black people in general. Like, why they not come to see me? I know I can name like quite a few reasons why they even get to me. And so that's why I try to go to them. Like, all right, what can I do to kind of, because I know there's a lot of barriers before you may see someone like me.
That's amazing. And shout out to you, bro, like, for doing that, because like I just it's so many things, and and then there's also fear too, right? So that factors in too, because there's fear where, like, for me, honestly, since my follow-up about my knee, which was in 2016, I haven't been to the doctor. I was 26, 27, and you know what I'm saying? I was 26, 27, and I'm 30, 33 now. Like, I'm a little like, at this point now, I'm a little like, okay, like, what like
keeping you from going to the doctor?
Well, let's talk about that. So at one point it was the cost of health insurance. No, seriously, at one point it was the cost of health insurance. I switched when I left the state. As you know, the state has amazing benefits. I was paying maybe $20 a check for this amazing health insurance, and then I went to a job that was private industry, and it was $150 for a high deductible plan. You know what I'm saying, per check. And I was like, I'm not paying for that. Like, I'm fine. You know what I'm saying? Like, I'm not that bad. Like, I'll be fine. I'll be a little more careful. And then I stayed at that job for 2 years. And then I went to another job that you had that waiting period before you could get benefits. But before the waiting period was over, I left and went to another position. So I never got insurance through them. I did get insurance through that next position, but then I got the offer to my current job within a month. And that kicked in within a month. And so now I have HMO insurance again. So I'm just in a process now of finding out where I want to go to for my health insurance. Like, I'm not going back to the guy who told me to come back in 2 to 3 years. So now it's find a doctor to go to, there's also the idea of hours, right? That's a big obstacle for me. It's okay, I'm still in my probationary period. I can't take off of work. So right now, so how do you get to this doctor if your hours are 9 to 5 and my work hours are 9 to 5? When can I come to see you? So I have to find a guy who's open in the evening.
Because again, that's real life. That's real life. Like, if your hours are the same hours of your workers, like something's gotta and I can't ask you to take time off work to come see me. Because then how you gonna pay me? I don't.
Well, you got to plan for that. I mean, there's a lot of barriers, but you have to plan. We all get PTO, use some PTO time, schedule your visit. You got to get it done. But,
it's just multifaceted, because within 6 months, though, you shouldn't be, you know what I'm saying? You have that 6-month probationary period where any time off that you want, and don't let you come in with a vacation that was pre-planned, which I did. I came in with a vacation that was pre-planned. So now they're kind of all right, bro, Like, like, all right, bro, like you got a few more months before your probation over. So my probation is over in December. But I've been looking for a doctor that has evening in or weekend hours to find that fits my demographic that I'm looking for, and that's not going to make me drive, an hour or two away to get to. So there's a lot of barriers, and that's for me, somebody that's going through it.
I
That's
will say,
conscious now.
yeah, and COVID has complicated things
Mm,
significantly. It's crazy, so, before COVID, maybe it would take you a month to get in to see a doctor. Now, post-COVID, you may be waiting 4, 5, 6 months just to get in to see someone because everything
mhm,
is so strained, and stress, and it's really hard. But
mm,
just to go back to your original questions, the barriers, that are preventing what I perceive the barriers to be would definitely be just finding someone you feel that can relate to you,
mm,
finding someone that you think is good and you trust is a big issue. Cost is an extreme factor. And I have to say, with some of these insurance plans, or employers, I should say, they give their employees these insurances that you can barely even call insurance. I've had people call me to see a doctor and they give me their insurance information, and they need to see a specialist. Come to find out, it's just a discount program and they have
mm,
no coverage to see a
mm,
doctor. They only have
mm,
coverage to go for their preventative exam, and that is it. Anything else
mm,
is out of pocket. So that's a big factor. Time is a major
mhm,
issue now. Um, and then some guys, I feel, I've heard a lot of guys say, I just don't want to know.
mhm,
They don't
mhm,
want to know if something's wrong. And they feel like if it's going to happen, it's going to happen. I'll be
mhm.
okay. But I think all of that goes back to the other issues of just the trust and the cost. It's easier for them to say, I don't care.
Yeah, and I agree. And then, like, back to the original point, I also have HMO insurance again too, right? So like I'm locked into a network. So it's already like, because HMO is considerably cheaper than PPO when you talk about health insurance, right? So I have this HMO plan. So not only do I have to find someone with evening hours and weekend hours that fits my demographic, but they also have to be in the HMO network, right? So you factor all them things in, and it's like, man, this is about to be yeah, rough. And this is for me who has, like, I have amazing, like, I'm back in a government agency, so I have amazing insurance again, through my employer, and this is just me. So, like, if you put in someone who may be low income, and when I worked for the Department of Welfare, in order to qualify for insurance, if you were a single male with no children, you had to make less than 1,300 a month. Let me repeat that again. When I worked there, you had to make less than 1,300 a month to qualify. And I'm sure it's probably up to like 15 or 16 now, but still, like, this is the income that you have to qualify for it through welfare. Um, and the people who have that limited income typically have low literacy levels, right? So you don't know, like, you just know I got health insurance. You show up thinking and hoping that it's going to pay for everything. You don't understand how to read, and this stuff that I still don't know to this day. Like, I don't know how to read a prescription plan. Like, I don't know. Like, my sister-in-law, the one I was just telling you about. Shout out to Tasha. I love you, sister. I sent her my health packages and said, hey, can you interpret this for me? Because I don't know what none of this stuff means. Like, and like, they give you these big behind pamphlet. It's like this thick. If you can see me, it's like really thick pamphlet with like the details of all the plans. Then on like the last page, it's just like a checkbox, like this insurance covers this, and this is your copay. And I'm like, well, that's the only part of this that I understand, but I don't know what this nitty gritty means. And I'm college educated, not to flex on though. Like, I have a bachelor's degree. So if you're like someone coming in with low literacy level, high school dropout, like, you don't know what the heck you signing up for. And I think that that's a huge barrier to things. Um, I'm trying to read some of these comments coming in. Random Reese. I don't know who Random Reese. Oh, I do know who Random Reese is. Understanding your insurance is a big issue too. Jules says some employer paid insurance covers barely the base. Um, my mom
Which is
says
what I was just
HM.
mentioning,
Yeah,
barely,
HM
barely.
is extremely limited. Like my ACL surgery, they sent me the invoice. It cost $40,000 for my knee surgery. and I didn't even get admitted. Like I was in there in the morning and home by 5 p.m. and it was $40,000. Like I can't afford that. If I didn't have insurance, I would be walking around with a torn ACL right now. Like, and to your point earlier, Barry, that's why when I'm 60, 70, you be like, yo, man, like, yeah, your knee been messed up. It looked like it's been messed up for a while. What happened?
Right.
And like, you know what I'm saying? Like, I ain't had 40 grand. Like, you know what I'm saying? Lord forbid when the insurance was 1,300, if I made 1,500, I didn't qualify. You know what I'm saying? Like that's not that much more, but I didn't qualify. So it's crazy. It's a lot of barriers to that, and I don't know if we have solutions to those barriers.
It's so multifactorial that you almost have to kind of pick and choose, like, all right, which avenue am I going to attack, and which avenue am I going to address, and then am I going to address the me? I was like, I'm going to address the education. I'm going to try to educate. But someone needs to handle the access, right? Because I know access is an issue, right? Someone needs to handle the fact that the pipeline is so trash that seeing a person like me like surprises people, right? Like I shouldn't, like when I turn the corner into my patient's hospital room, they shouldn't they shouldn't do that. Right? Like they should be so used to seeing Black physicians that it doesn't like, oh, okay, all right. But like I know, like when I walk in the room and they see me and I see them and they gave me the look, they know like, oh, okay, I'm okay. Like, and that's so we got so many battles that we have to face, that we have to fight to get to some point of equity. That it's gonna be a work in progress for sure.
Yeah, and it's tough. It's a battle. I do think I will say that I know that there are more African Americans getting into this field. There are more African Americans being educated. Like I think we're at an all-time high statistically at where African Americans are in their levels of education. So there's the hope that things are starting to transform. Like you guys said, some of the money is starting to shift to the preventative side. So let's just hope that, nothing's an overnight fix, but let's just hope that as we continue to develop, there'll be more Black doctors, there'll be more Black trust. And, like I hear what you say about the vaccine. I don't want to bring it up, but like, I get why, like, it's almost sad that there are so many people at this point who are anti-vax primarily because they don't trust. And at this point, like, cause the stuff is out there, they just don't trust what's out there at this point, So, and that's crazy. Like, that's such a big problem in itself that it's like this stuff is out there, but me as a Black person, I don't trust it because, like you said, we've been wrong before. I'm not about to.
Yeah, we've been wrong. So that's how I tell, because I do it. So I say, so first of all, I'm not even here to argue with you. I understand, right? But let me try to take you down, and then say why this is okay, right? Like this one you can kind of trust. Like we're here. Right? Before we weren't on the side, right? We weren't on our side, right? So there wasn't a lot of us, so they could do the type of things that they were doing to us. More of us are now on the other side of the table, so we're not gonna let that happen. Like that's not happening, right? Under our watch, like that, it just ain't. But again, I understand, right? When they say doc, when they tell me the amount of people, like if you follow my Instagram, like I post a lot of my YouTube related comments because people hate me on YouTube. I don't take it personal. I tell my wife I don't take it personal. I understand why. So I try to educate. They don't like the way I educate, so they call me bad names. Okay, cool, right? But like, I just gotta keep doing it because I gotta be able to, like, I'm gonna touch somebody who's like, all right, let me listen to what this guy over here is saying.
I can't believe that.
Oh no, they don't like me. It's like if I wasn't so comfortable with myself, like they trying to go low.
Oh man, people they hide behind the safety of the keyboard, man.
Oh, they do. They be the most random usernames, like crazy stuff to me. I remember when, like, it was like someone, I guess the way they signed under, like, I guess they own like some video production company, and they were like, you're like one of the worst doctors here. You're an idiot. I'm like, cool. All right. It's all right. This is what we sign up for, right? If we're gonna educate, right, we got, there's gonna be people who's not gonna, like what we say, and we just gotta just kind of, keep it moving.
Yeah, that's right, man. You can't look, man. My mom used to always say you can't argue with a fool because from a distance you don't know who's who.
Did your mom say that or Jay-Z?
I feel like my mom told me that. I don't know. Look, the older generation always got them random quotes, man. I don't know where they be getting them from. But they'll break out some stuff and you'd be like, oh, that kind of makes sense. So to kind of shift gears in the conversation, I know we kind of talked about, the health insurance side. What are the benefits, to seeking? And I know we dug into it a little bit earlier, but what are some more of the benefits to starting now, right? And not thinking, I'm young, or I got a few more years, or, oh, I don't feel bad. Like, that's always in my thing. Like, as long as I can walk, I'm fine. Like, and so what are some of those benefits of seeking a healthier lifestyle now?
Well, it all goes back to the preventative side of things. If you start now before there's a problem, there's a lot less work to do. Starting now just helps you form healthier habits, which is the best way, to stay away from all of these health issues. It's really hard to drastically change your eating habits. So if you're gaining weight and you're having all of these health-related issues related to weight gain, for you to all of a sudden change 30 years of a eating pattern, in unhealthy habits is not to say it's impossible, but it's going to be extremely hard to undo, 30 years worth of bad behavior. So if you start making little changes, and I think this is where a lot of people have problems because they feel as though, okay, I'm going to go diet. I'm not going to have any sugar. I'm not going to eat anything fried or bad. I'm going to have this perfect, healthy lifestyle. You really can't try to make all of those changes at once. It's best to start now and make small changes. Like, I'm going to walk 3 days a week for 30 minutes. A lot of people, they want to go to the gym and do, 2 hours gym time, lifting weights, running. That's unrealistic to maintain that for a long period of time. So if you just make these little small changes that you can realistically keep up with, it's going to make a huge difference in the long run. Just walking 30 minutes, 3 days a week, maybe build up to 5, just saying to yourself, you know what, I'm not going to eat French fries every day. I'm going to eat French fries on the weekends, or I'm not going to drink 5 sodas a day. I'm only going to have a soda if I'm, at a restaurant or if I'm out in the street and I can't get to anything else. Something as small as that can make a big difference. So, you definitely want to start early just so that it's not as hard, for you to make those changes when your life is literally on the line. When your doctor is telling you, hey, you have type 2 diabetes, so you can't have any sugar or you're going to go into a diabetic coma. How hard is it going to be for you to completely cut out sugar when you've been eating tons of sugar for years and years? It's really hard to do that. So, it's just easier in the long run to start making little changes now, so that you're not working as hard in the future. And I don't even, it's so much to say. I don't want to take over the show. Just talking, so I'll let the doctor go. But
it's your show. It's your show. I just hosted.
I know.
All right, I'm done.
Yeah, no, what's crazy, I think a lot of us downplay, especially, when I talk to a lot of my elderly patients, one thing they always, ask for is time, right? They wish they had more time to do X. And when we're young, we typically will downplay how much time we have. And because we downplay how much time we have, we allow these bad habits, right, to fester. And what those bad habits do is they take months and years away from us. And of a lifestyle that we actually enjoy, right? It's nothing worse than talking to an elderly patient who just hates their last 5 to 10 years of their life because they're constantly in the hospital or in the doctor's office or at home because they hurt. Like it's like that's not an enjoyable life, and we typically will downplay our end of life care because we're trying to enjoy the middle. right? Like we were balling out during the middle because like, I'll be cool. And then you turn 40, 50 and you didn't get those screenings. You didn't get those tests. You didn't do those things you need to do. Now you got colon cancer. Now you got prostate cancer. Now you got breast cancer. Now you got all of these things there. And now you can't even enjoy like the rest of that time because now you're just doctor to doctor, illness to illness until the finale. So I think if I always try to sell the time factor, like you're going to be 40, you're going to be 50. Like that's going to happen. Like, do you want to enjoy it? Right. Or you want to be taking 50 medications when it gets there? Like you choose. Like, and then, I mean, we gotta be honest, it costs a lot of money not to be healthy. It costs a lot of money not to be healthy. This is not a cheap way out. Like it may be cheap now. Like again, that McDonald's burger is cheap now. It's expensive later. So we just got to shift our mindset, and that helps drive a lot of things for sure.
And it's crazy to hear you mention that because it's something my friend Frank, and Frank is in the military. He's a Marine. And I think he said he's a staff sergeant in charge of training new recruits now. And he was talking about how last episode he was talking about how quality of life, like this is this term that he threw out to me one time and I've known Frank since we were in elementary school. So we were talking one day and he was like, yeah, what do you want your quality of life to look like? And I could remember like maybe 2 years ago, Barry, I'm over in New Jersey playing basketball. There's this older white guy out there, and I'm like, old guy out there. He's shooting, he's knocking, he's like Steph Curry out there, knocking everything down. He couldn't really get up and down the court as quickly as the rest of us, but once he got that ball, that thing was going down. And I'm sitting there, and when they threw a outlet to him, and I tried to intercept it, and I ran into him like my full body weight, boom. Helped him up, knocked him off. He's still getting out there, knocking it down. So after the game over, I'm like, man, old head can shoot. They was like, yeah, he's 70. What? Like, I'm like, what? Like, like 70? Like, and so when I think of this idea of quality of life, right, I think of if there can be a 70-year-old dude on the court with my, at the time, 29, 30-year-old self and keeping his own. Meanwhile, you get 40-year-olds, 45-year-olds with strokes, heart attacks. You got 50-year-olds that's wheelchair bound on the cane, on the walker. 60-year-olds, who like what did Frank, my friend Frankie said? He said you had this thing where you wake up in the morning and you think about your day. I got to do this today. I got to do this today. He said, imagine waking up, grabbing your pill container, having like 8 or 9 pills in this for Friday, having to pop all of them first before you even could think about your day. Like that's the first thing you gotta do every morning. And when you think about that, it's like, I don't want that to be my life. And if that means I gotta start eating some solid now, then cool. Like if that means, I gotta start going on a walk, cool. If that means that, what I'm saying, I gotta cut this out my diet or kind of slow down on this or, things like that, then cool. Those are changes that I'm willing to make because I understand more now than than I did before what those ramifications look like. And I think that conversations like these, right, are really helpful for people in my generation where you can say like, well, no, look, this is funny. Son puts this comment up right here. He says, that's how I'm going to be killing you in the court when I'm 70. Reese. Son is almost 50 and he moves on the court better than me. Like, which is crazy to me. Like, if you saw this guy in real life, he's only like 5'1", but like, you see the way he gets up and down the court when we play, you would think that he was like 27 or 28. And like, it's crazy because he was at the gym. He's the one that invited me to the gym when this happened. Like, I'm like, he can do this up and down the court. It's 45. And I know 20-year-olds who like, no, I can't play ball no more. Mm-hmm. Like I know 25-year-olds who's already like, no, I'm done, man. Like I can't do that no more. Like, what are you doing? Like, what do you want your life to look like down the road? Like, so little things like understanding family history. Like diabetes runs in my family. Like it legitimately runs in my family. High blood pressure runs on my dad's side. My grandmother has a history of Alzheimer's. My grandmother on my mom's side passed away from sickle cell. Like we have health issues in our family that we're aware of, and I'm privileged to come from a 2-parent household, right? And there are some people who don't know one of their parents, right? So you don't know what the hell runs in your DNA from one side of your family, so you have to be mindful of what it is that you're intaking, what it is that you're doing. Find something that works for you. And this is something another one of my guests said one time. He said, we never say, oh man, I got to make time for for that alcohol, for that party. Oh man, I got to make time for this girl to come over. We don't do that. You do it. You know what I'm saying? So like, you got to do the same thing for your. We talking about your life here, like like your life, like not a moment, like your life. So that's my rant. I'm done. I'll let you guys talk again.
No,
Yeah,
you're
no,
right.
I think no, you hit it right on the head. It's just we have to, and again, I'm not sure where that mindset came from, where we feel like by the time it's 35, it's all done. Let's just pack it up. And I'm like we're supposed to start enjoying life once 35, 40 hit, and we're doing things that's not conducive to enjoying life when we're 45 and 50. We're just not making sense to us, especially if we say it out loud. So we just gotta, we gotta just really just kind of understand that yes, you can be young, you can be your 20s and 30s, and you can be in your, especially my 20s. My 20-year-old folks, they're like super invincible, right? Right. So you can still do that, but like think like the 30s are coming, the 40s are coming, the 50s are coming, the 60s are coming, right? You'll be able to be healthy throughout all of those decades too.
And so I'll ask you this from, just from like a literacy standpoint. I know we got to get ready to go soon. Um, if I'm somebody and I'm going into a doctor's visit for like the first time on my own, like I've only really gone when my parents took me as a kid, right? So this is my first time going through this process on my own. What are some things that you recommend that you say that you make sure they do? What are like the typical tests that they should be running? Like for me, I haven't been to the doctor in 5 years. Like what are some things that I need to be mindful of when I go get this checkup? In a few years, and just anybody in general who's like trying to make that change and trying to get in front of a doctor.
Yeah, I think some of the most important things, especially when we think about just kind of health and our wellness, is kind of from in my age bracket. How healthy should I be? What are some of the things I should be looking for? What I typically tell my younger colleagues and friends and everything else, who when I got to push them to go to a doctor, is that there's certain things that even when you're 20, 21, 25, 26 that we're checking for, right? A big thing, right? What I see, what happens is like a lot of times we don't know our family history, and in the doctor's office, family history is just as big as your personal history, right? Like I need to know, right, if dad had high blood pressure. I need to know if mom had diabetes. I need to know if someone has cholesterol. I need to know if cancer. I need to know these things because that's going to help me, right? Help you out in the future. That's going to help me prepare you. So understanding, coming in your backpack with that information that like, all right, this is what my family got, right? And I'm 21 years old. I'm healthy. I'm doing all the things I want to do. Like, what should I know, right? Like, so the doctor's going to be like, yeah, well, let's make sure your blood pressure is fine. Let's get a baseline, right? I want to know how are your kidneys? How was your liver? What's your urine like? What's the like? Let's just get a foundation. And for a lot of us, we don't even have the foundation. That's what messes us up when we get 30. When we get 35 is because there's no foundation. So you come to me as a 35-year-old, and all of a sudden I'm like, oh, your pressure's kind of high. Your kidney function's not as normal as it should be. Like, is this normal? Like, I'm gonna ask you, oh, is this normal for you? And because you don't have no foundation, we don't even understand if that's normal. So we just have to assume everything is abnormal. Like, oh, this is all bad and new, and now we got to do work. So establishing yourself a foundation like you would do anything else, right? If you had a house, you want to make sure it's on firm foundation, but we don't take care of our bodies and ourselves in that same way, right? Establish your foundation, know what your the amount of people who walk into these grocery stores and never stick their arm into that blood pressure thing. When I ask, oh, what is your blood pressure? Like, they never do it, but it's there. Like, y'all go to the farm, like, just a quick little 5 minutes or however long it takes, get your blood pressure. Oh, okay, that's the number, and to keep it moving. But because, again, you said it earlier, we have this fear, and I mean, Natasha said it, we have this fear that we don't want to know. And if I don't know any better, then I'm cool, right? If I don't know that I'm not supposed to be going to the bathroom as often as I'm going, I'm cool. If I don't know that my stool's not supposed to look like that, then I'm cool. If I don't know that the weight gain or even weight loss, because weight loss can be a problem too. If I don't know that these things are problems, then everything is hunky-dory until they see Dr. Pierre in the hospital. And I'm like, hey, fam, you got like We got a lot of things we got to talk about before you get out of here, for sure.
That's dope. And then there's, because I think like stress induced symptoms, they're real things. So I'd imagine like that's why people don't want to know. Because like if I don't know, I'm not stressing about it. But if you tell me my pressure is up, if you tell me, I'm pre-diabetic, if you tell me those things, now I'm like I told you, and my joint was a wellness screening. I did my wellness screening to get my insurance discount, like, and that's how I knew my blood pressure. And they told me my numbers, and I said, am I about to die? Like literally, that's what I texted her. I said, cousin, am I about to die? She was like, no, no, no. And like I said, luckily I knew that my baseline was typically like 110/64 because I remember thinking that was too low. And I was like, do I need to stress out a little bit more? Because aren't you supposed to be 120/80? And they were like, nah, you cool. Like, it's a little low, but like you just a relax. Like you seem like you're a relaxed, laid back guy. So I'm like, how did I get the 129/94? And what does that even mean too, right? You know what I'm saying? So I still don't really know what it means. I just know I need to make changes. You know what I'm saying? So, but Tosh, I want to kind of give you the floor to kind of respond to what Barry was saying.
Well, just kind of going off of what he said, it is important that you go because they need a baseline. They need a foundation to look at to see if there's anything wrong or if there's been any negative changes. Because if you don't have that baseline, it's like, everyone is different. So, and everyone has a different baseline, which is what I think people don't really understand. Everyone thinks that there's just this one magic number that everyone has to be at. Yes, there's guidelines, but then, what is normal for one person may be abnormal for someone else. So if you don't establish that baseline, it just makes it harder for the doctor to treat you appropriately. So it's really important, again, that you keep with the prevention. You go for your yearly physicals. You try to have a good relationship with the same provider so that when there is a change, they can recognize it immediately. And, again, go to your preventative screening so that they can, catch those changes quickly. Not, don't wait 5 years. Now you come back to the practice and it's a whole new doctor who has no idea. They done got rid of your medical records. Nobody knows what's normal. And now you're 4 years behind on preventing something that could have been stopped in its tracks if you would have just went to your preventative exam. So my thing is just make sure that you have a doctor, make sure that you schedule your annual and preventative screenings that are free. You definitely want to utilize anything that's free, because those things are the things that are going to make the biggest difference in your health, just utilizing those free preventative screenings so that they can catch things right away. And then take accountability, make sure that you're eating right. No one's perfect. No one's going to eat healthy 100% of the time. But again, just try to add those little changes to your daily routine. Try to make sure you're walking, get at least 30 minutes of some sort of consistent exercise a day. 5 days a week is actually pretty good. But if you can do 7, it's even better. If you're just walking 30 minutes, 7 days a week, anyone can do that. And just try to make better food choices. It's hard, but try.
That's good. And real last thing before I get you guys a chance to, plug yourselves, Jewel has a comment here, and maybe this one's for you, Barry. I feel like screening ages should be 30 or 35 instead of 40 and 50. How do you feel about that?
No, I agree, and especially I always got to put the asterisk, especially for us, right? I'm biased, right? So I typically look out for especially the African American community. And I know that if you name a disease process, it's typically caught in us at later stages. So a lot interesting now, a lot of the guidelines, like for example, like let's say colonoscopies are, they used to be 59 or 45, but if you're African American, it's actually 40. Mammograms 40. 35. Like it's a lot of things. And the reason why they have to do that is because they're catching it in us at such a later stage that, and unfortunately, and that's why I kind of mentioned time earlier, time is money, right? So if I'm catching a disease at a later stage, I have less options to treat. If I have less options to treat, that means you have less likelihood of recovery. So I'm big on trying to move things as sooner than later, because and again, some will argue like, oh well, we're gonna screen too many people. Like, yeah, I want to screen. I'm okay with screening too many people if I catch and I save lives. Like that's the whole point in that regards. But again, if you don't even know, right, that certain screenings are a certain age, You just walking around life like everything's good. Like, but if you don't, so that's why it's one of those things where your doctor really has to be on point to say, oh, I got this 25-year-old. I know what I should be checking for in a 25-year-old. I got this 35-year-old. I know what I should be checking for in this 35-year-old. I know what questions I should be asking for in this 35-year-old, and not necessarily again. No one more than me likes educating my patient to be empowered for, and that's my motto: empower yourself for better health. But like it's still up to the doctor, right, or the healthcare professional, whoever that person is, to be able to be like recognize, like, hey, fam, you're 40 years old right now, and you're supposed to have this, and this done. Right. So let's talk about when we scheduling that. So no, I definitely agree. You know, moving things over, and that's why I like getting my 20-year-olds in the office, and I just tell them like, hey, boom, your birthday, let's get this annual checkup. Boom, I see you next year for your birthday. Like, I don't have to see you 4 times a year. You're healthy. That's the whole point. I should be seeing you next year for your birthday, right? Because we got to make sure that foundation continues when you're 21 to 24, 20. Like, we got to make sure it continues along the way. And then when you start picking up things, right, when, you know, if you get the high blood pressure, if you get the diabetes, if you get the high cholesterol, now all of a sudden it's not every year, maybe it's every 3 months, every 4 months, every 6 months. I'm keeping a much closer eye on you, because I know that because time is money and time is life. So I got to make sure, like, all right, yeah, you're good. 6 months again. All right, keep doing what you're doing there. And so it's definitely important from a screening standpoint. I definitely agree. You know.
Oh man, so what I just heard is I need to go get my prostate checked out. Oh man.
Oh yeah. And again, prostate's the number one killer for African Americans. It always catches us much more sooner than everybody. And typically we are asymptomatic until we're not. Right, like no symptoms. Typically we have no symptoms until we have symptoms. We don't want to have symptoms. We want to catch that early. Boom, boom. I see something happening. We got a family history. All right, let's keep moving. Let's go from there.
Yeah, and we that's something that we just got to be mindful of. Like, one of my friends turns 40 tomorrow, and all I've been saying to him like is, you gotta get a finger in your ass. Like, literally, that's all I've been saying to him like all year, like messing with him. So like, that's stuff that we got to be mindful about in the male community, right? Like, bro, like,
you gotta be okay. Like, right. I can't wait for my 40th birthday. Colonoscopy. 40th birthday, I'm scared. Like, hey doc, I'm 40. Right, everything good. All right, I'll see you at 5. Like, we have to make it like, now I'm about my health. Like, my health is my money. Like, my health is my time. I gotta live, and I can't live just acting like everything's cool to go.
Right. And so it is just something like that I'm going to be mindful of moving forward, because I get it. Like, that's all I hear when the prostate come out. Like, man, I ain't letting no man. Like, bro, like, cut it out, man. That doesn't mean that you're gay. Like, you're not gay. Like, you're not. Like, you're not. You're healthy. All right. Before I go,
I probably
That's what I told you. We've been tackling all these joints, man. We did Luster already. We did Pride. This month was Gluttony. Halloween is coming up. So you heard it from the fitness people and the healthcare professionals. Guys, be mindful, man. Halloween is this weekend, right? Yeah, sheesh. Be mindful, yeah, of this like the candy intake. Be mindful. Last episode, Frank said something about how your whole life you've been eating a certain way. And so a lot of the diet is inherited, right? So like you inherit, like I season my food a lot because my mom seasoned my food a lot, so little things like that. You have inherited habits. So start to train your kids now. Like, they're going to eat what you feed them. My son has autism. He doesn't eat candy because he was like, never got it. So now he's 12, and like I offer him a piece of candy. He's like, he just started taking fruit snacks maybe like a few months ago, and his mom rips me a new one every time I tell him that he ate one fruit snack. And I'm like, he's not going to die. It's just one. Like, remember how far we came? But I'm very happy to say, like, he doesn't drink soda. His preferences are like water or orange juice and things like that. But that's because, like, those were things we never introduced him to. My daughter, I do not give her candy. She asks me for candy all the time. She gets candy when she's with my mom. But like, I do not give that little girl candy. Like, I don't. Like, I gotta split out. Don't. But like, I can tell that when she's with her mother, like, that's something that's offered to her. Like, same thing with like juice and soda, because she'll be like, I'm thirsty. I'll be like, I'll go grab a water, but I want juice. Well, it's water sitting right there, and then she just won't drink anything. Me myself, like, I have to make myself drink water because growing up it was something that I never drunk. like I was never forced to drink. So now as an adult, I'm kind of like, I really gotta drink a bottle of water. I don't really like it that much. So like inherited diet is a real thing, right? So being mindful about yourself also means that you're being mindful about your family, your children, and things like that. And like you said, man, it's never too late because even if you are 60 and dealing with health issues, you're setting that baseline for generations to come, right? So now people can look at me and say, oh, well, Maurice struggled with this, so it's likely that his family or his children might have some of these same things. So that's some real good information that came out. I do want to give you guys an opportunity to talk about what you got going on outside of here. Tosh, I'll start with you. How can they find you on social media? Are you okay with people messaging you stuff? She don't post nothing. Look at her. She like, don't follow me.
They can't find me on social media. They have to call you.
I like it. Well, what is worth? It took a lot of begging to get her on here, so I'm just happy that she did it. She is very, very, very informative. My brother was actually messing with you throughout the episode. I didn't put some of the comments up, but I do want to go back to this one because you won't talk. I'll mess with this one. When you came on with your glasses, that was the Mills. He said she's smart because you came on with your
I
glasses.
am, and don't forget it.
She goes, how much do you give him on his birthday every year? Was it $1?
$1. Oh, he's up to $2.
So they give each other
He's
two.
doing so well in life. I'm gonna have to give him $3 this year since he got a baby. $3 coming away.
Well, cuz thank you so much for coming on. I love you so much.
Oh, thank you, guys.
And I got another cousin in the comments, my cousin Ed. Thank you so much for coming. She put the glasses emoji up. Barry, we know you worldwide, Barry.
Oh, right. Yeah, no,
How can people
I'm trying to
go on ahead?
I tell people, Dr. Berry Pierre on pretty much all social media platforms, Instagram, Facebook. I'm on TikTok now. I do my TikTok. I honestly, that
was my TikTok dance.
Platforms like real estate. Like anytime social, like, oh, you know what? Let me just go sign up over there. Keep my name just in case one day I'm gonna do something over there. Like I like no one won't have my name. So I typically do that. I have a podcast that we come out every month. Every week. Lunch and Learn with Dr. Berry. It's available on all podcasting platforms. Today was actually a good one. We're talking about sex confidence today with Dr.
Yeah, I saw that clip.
Yeah, today's a good one. So sex confidence, sex health. Like we talk about, we're grown up, right? We got to talk about sex. Sex is okay. And so we talk about that. So again, my goal, I'm just trying to educate us, especially us, right? To understand that health it's okay to be healthy, right? Like it's okay to be educated. It's okay to be empowered. We got to take our health in our own hands. Let's get it, because there's not a disease that you can't name that we're not affected by more. COVID is another one, right? But there's not a disease that you can't name that African American community is affected at a much significant higher rate than other communities, right? So for us to turn that around, it's hopefully happen in our lifetime, but for us to turn that around, it's really going to start with us kind of being educated, and those in the position to educate, to say, all right, I'm here, let's go.
And Barry, just honestly, man, just shout out to you, man. It takes people like yourself, right, to make the change. And I love people who are trailblazers. And what I see you doing in this field is something that I've never heard. Not that I've talked to a million medical professionals, but it's something that I haven't heard of, before. So I think it's just amazing that the passion that you have for our race, for our people. And just thank you for that. And I wish you was in Philly, man. If you was in Philly, I'm like, all right, Barry, so when you free, man? I gotta go get checked out.
That's good. And that's why it's so funny. I try to highlight, because there's not a lot of us in this field, but there's a lot of us who want to educate. So I typically have a lot of African American professionals, whether it be psychologists, physicians. I typically have a lot of us just so people can see, oh, okay, all right, wow, all right. Oh, I didn't know we did that. I didn't know we did that. Just so it's because once you see it, then that barrier that it can't happen is erased. Then it's much more likely to take some action.
And this is my every episode I always plug this. Therapy is okay. Therapy is good. Um, Barry's wife Marie is also a therapist. She's amazing. Um,
she gets on me. So
I probably
mental health is
yeah, mental health is real. And I say it all the time. Black men need therapy. Um, if you're black in general, you just need therapy for being black. If you grew up in a low income environment, you need therapy for that. Like, there's a lot of layers that just because you're black and in America that you need therapy for before you get to what happened in your life, right? Like, so like, there's not a person listening to the voice or who will watch my voice or who will watch this that should be like, well, I'm okay. Like, going to therapy doesn't mean you're crazy. It doesn't mean that you have deep rooted issues that like you're strung out or anything like that. Going to therapy is the same as getting maintenance on your car. Like you said, getting a checkup. Like if you go and get your car checked every year, get your oil changed every 3 months, you go see your therapist routinely. Like, and it doesn't have to be a weekly thing. Like, of course, early on you'll probably go a little more frequently, but then you'll get to the point where it's like, okay, just doing check. I'm just checking it. Quarterly checking it. And then when you have a leak, also you have someone similar to this, right? You already established this rapport, so you go to this therapist who knows you already, and they're like, "No, I know you. Like, something's wrong today. Like, talk to me, but you got to start somewhere, right? So go get yourself a therapist. Marie Pierre, I don't think that she's up here. I'm not sure if she does virtual services or not. Barry,
she does. I know she kind of pivoted, especially into the autism space.
Okay,
that's kind of her. She's kind of ran up in that lane. We can have a whole conversation. That's a whole nother lane that obstacles on top of obstacles as well. Therapy for Black girls, therapy for Black men, right? The opportunity resources are there. Again, I talk about it: mental health, spiritual health, physical health, financial health, right? Sexual health now, especially with Dr. Sherman. Like all of our health's got to be like optimum, right? If we want to live the life we're trying to live.
So, but thank you guys for watching. Next month we are doing MV. We're going to cover all 7 of these things. So next month is MV. I believe I have my good friend Nigel Charles coming on, and my buddy Vince, who was on earlier this episode. That's probably why he chimed in so early, because he knew he's about to be on the show. But my buddy Vince and my buddy Nigel, we're going to talk about MV and kind of how that manifests. And I wanted to do that in November because Thanksgiving is coming up, right? You should be thankful in the month of November because in the holiday season in general, right? November kind of like officially kicks off like this holiday season of like being giving and things like that. And I think that that's a time where envy starts to creep in because it's like, why don't I have this? Why can't I give my kids this? Why is this person able to do this? And you're kind of jealous. Like I know I was single last Christmas, and last Christmas was the first time I woke up, and it wasn't my year with either one of the kids, and I didn't have a girlfriend, and then I woke up in the apartment by myself, and I opened up Facebook and saw a million couples in matching pajamas, and I said, oh man, like, why don't I have somebody with me in matching PJs right now? So I wanted to kind of cover envy leading into this holiday season. So I'm really excited about that. In November, what that's going to look like. That will be, let me get the date for you guys. I believe it's November the 10th, but let me confirm. Yeah, November the 10th. We'll be here talking about envy. So thank you, Barry. Thank you, Tasha. You guys are amazing. Thank you guys for viewing. Don't forget, go follow me on Instagram at my brother show. I'm going to put that on the screen in a second. There we go. At my brother show. And this is up on YouTube. If you're watching on YouTube, click that subscribe button for me, please. And yeah, I have a great evening.
Thank you for allowing me.
I had fun.